Actually is a life-saving procedure, and if you do it regularly, then we can help to prevent cervical cancer. Pap test is a test to screen for cervical cancer, and it is provided for women who are sexually active between the ages of 20 to 65 years old. Okay. This is the, okay, so this respondent said, sakit, malu and scary for the results. Okay, so this is totally understandable because when we get the results after having the Pap test done, it can be very nerve-wracking, rasa anxious while waiting for the results to come back. But actually what you can do is you can talk with someone you trust, and you can definitely talk to the doctor and the nurses so that we can give you support to reduce your anxiety while waiting for the results. Okay. Alright, so this is, it hurts bad. I think this is quite a common experience. I wouldn't say it's for everyone because different people have different experiences when they do the Pap test. But we do hear a lot of the feeling that it's uncomfortable, that it hurts. And I think we just need to explain a bit about how the Pap test works for some people who don't know. When we do a Pap test, we ask the woman to lie down on the examination table, and we would require her to undress from the bottom, and we will put kain on top of her. And then in order for us to look at the cervix, we actually need to put a speculum inside the vagina. So this is a speculum it looks like a long plastic cylinder with a rounded edge. So this is what we have to put in gently inside, and then we will gently open it up in order for us to look at the cervix. So this is the part where most women find uncomfortable actually. The part where we have to take the sample itself, it shouldn't be uncomfortable. It should only feel macam strain saja, but it's not. It wouldn't hurt. Okay, so once we take the sample, then we put it in the vial, and then we send it off to the lab, and then we will take the speculum out from the vagina, and that's it. That's actually just it. So now going back to the point where it hurts bad, sometimes it could be that the size of the speculum in the ngam. So we can use a different size next time, maybe a smaller size on your next exam. There could be other reasons jua for the fact that it hurts. Kadang-kadang the positioning is not proper. It could be that if you are really anxious, then you might feel a bit of pain when the speculum is inserted. But all in all, we do try, the nurses and the doctors do try to be very gentle when we put the speculum in, and we try to tell you all the processes that we do so that you are prepared for it. Alright, so this one, some people said to do it only after you get married because it will break your hymen. Okay, so there's 2 points here. One is do it after you get married, and then the other point ini yang pasal the hymen bit. So with regards to Pap test, we actually recommend it for people who are sexually active. So it doesn't really matter if you are married ka, Indah, whether you're divorced or widowed. As long as you've been sexually active before and you are between the age of 20 to 65, then you should have the Pap test done. Okay, and the point about the hymen bit, so for people who don't know, hymen is like a thin layer of tissue that covers the vagina, and people believe that with sexual intercourse, then the hymen will break. Okay, so the thing about when we do a Pap test, we do it very gently, and we use an appropriate size speculum, like something not too large. So as long as the size is okay, we insert it gently in, then it shouldn't cause any trauma or shouldn't cause any too much pain. So I hope that answers your question on that bit. I'd just like to mention lagi that I know that a lot of people have concerns about pain and uncomfortable discomfort during the Pap test, and maybe you've had a bad experience before, but it actually is a life-saving procedure, and if you do it regularly, then we can help to prevent cervical cancer. We at EDCP, we do the Pap test here, and we try to be very gentle with our clients, and we are here to talk with you. If you have any concerns or any questions, then please drop by or leave us a message, and we'll be happy to get back to you.